In the last few months, we all praised Kerala's fight against coronavirus. In fact, the Kerala model was hailed by several experts, not just in the country but across the world. It was emulated by other states as well. While every state was grappling with COVID and struggling to control infections, Kerala was doing a stellar job. However, in the last 1 week or so, cases have been steadily rising in the state of Kerala. And so in this video, we explore if the Kerala model is flawed, what really has gone wrong, and what's led to the sudden surge in the number of COVID cases in the state. Post-Onam is when we really saw cases going up in Kerala. Let me just tell you about how from September 5th, the number of cases every single day being reported was over 3,000. By September 27th, it's reached the 7,000 mark as well. Kerala now has more active cases than Tamil Nadu, which makes it the fifth state, the state with in fact the fifth highest number of active cases in the country. So why exactly is that? Let me break down for you three reasons why we've seen over 35,000 cases being reported in the last 1 week in the state. So the first reason is that of the unlock guidelines. The reason Kerala was so successful in fighting coronavirus initially was because of the strict lockdown policy and the implementation of the lockdown in Kerala. There are no restrictions, so people are going out a lot more. There's a lot more contact between people, and so the spread of the virus has also increased. Kerala Health Minister K.K. Shailaja, who's faced and who's earned a lot of praise from across the world for how she tackled COVID-19, has now in fact put the honors also on the opposition. Remember that in the last few weeks, we've been seeing a lot of violent protests on the streets of Kerala. This is over the Kerala gold smuggling scam. Now, Shailaja has said that this has led to a serious problem, that it's led to the spread of coronavirus because these are irresponsible protests happening. She's highlighted data that suggests that people between the age group of 20 to 40 have been testing positive more frequently than other age groups, to say that it's because of these protests that the virus is spreading faster. And it is in this regard that the Kerala government, particularly Health Minister Shailaja, has warned that they could go ahead and decide to have another lockdown in the state if things are not brought under control. And as she states, if people don't act responsibly, the government will be left with no option but to once again lock down several parts of the state. Reason number two is community spread. Remember that while the centre maintains that there's no community spread in India, the Kerala government months ago, even when they were earning praise for their fight against coronavirus, confirmed that there is community spread in the state of Kerala. And you see that now as well in the kind of figures that are coming to light. With no lockdown, as I mentioned, people are interacting a lot more, and there is community spread, which the government is struggling to bring under control at this point. Take a look at these numbers. For example, as of September 27th, going by the Kerala government data, 1.55 lakh cases out of the total 1.74 lakh cases were those with history of some contact with COVID-19 patients. And that gives you a sense of how fast this particular virus is spreading. This is why the Kerala government said that yes, there is community spread in the state, and they're doing all they can with extensive contact tracing exercises to ensure that people who have come in contact with any COVID patient is immediately quarantined, immediately takes the necessary precautions. Remember that most of the cases right now are asymptomatic, and that proves to be also a huge challenge for the government in identifying who's been tested positive, who has possibly come in contact with a COVID patient. The third reason we're seeing a COVID surge in Kerala is because of more testing. The Kerala government has decided to push their testing up. They've ramped up testing considerably, particularly in clusters and containment zones. That's why you're also seeing the test positivity rate, which is essentially how many tests have come out positive in a certain sample that's been tested. That has continued to get higher and higher by the day in Kerala. The reason for that is because most symptomatic people living in clusters and containment zones are being tested. However, while you have more aggressive testing in these areas, in these containment zones and clusters, experts opine that there needs to be a lot more testing done in Kerala. They're saying that it's not enough to have a strategy where you only test in certain pockets. It must be ramped up across the state. Only then will you be able to understand the amount the infection has spread, to what rate it spread, and when perhaps Kerala could even reach its peak. As of September 27th, 27 lakh tests have been conducted in the state of Kerala, and the government has maintained that they are only going to ramp up testing further. So these are some of the reasons why the number of COVID cases is growing at an alarming rate in Kerala. Kerala had one of the lowest figures in the country. Right now, it could perhaps enter the top 10 states with the most number of cases at the rate at which cases are growing in the state. The Kerala government has assured that all steps are being taken right now to contain the spread of the virus. They have, however, also put the onus on the people, locals in Kerala, to do their bit and ensure that they take the necessary precautions. The fight against coronavirus is nowhere near over, and that's something we must remind ourselves about on a daily basis.